Enema is a medication that can be used to relieve occasional constipation. It is important to talk to your doctor or pharmacist about other treatment options and to use milder products whenever possible. Your doctor may also prescribe this product to clean stool from the intestines before surgery or certain bowel procedures. Enema works by increasing fluid in the small intestine and usually causes a bowel movement after 1 to 5 minutes. It is not recommended for use in children younger than 2 years of age. Always use enema only as directed by your doctor. Before using this product, make sure to wash your hands. Lie on your left side with your knee bent, or if you find it more comfortable, you may kneel and lower your head and chest forward until the left side of your face is resting on a flat surface with your left arm folded comfortably. Gently insert the enema tip into the rectum and squeeze the bottle until the recommended amount of the drug is inside. Stay in position for 1 to 5 minutes until you feel a strong urge to have a bowel movement. If your doctor has directed you to use this product before surgery or a bowel procedure, your doctor should tell you how long before the surgery/procedure you should use this product. The dosage is based on your age, medical condition, and response to treatment. Do not use more of this medication than directed. Use this medication more often than once in 24 hours, or use this medication for more than 3 days unless directed by your doctor. Also, do not use any other laxative products while using this product unless directed by your doctor. This medication may cause a condition known as laxative dependence, especially if you use it regularly for a long time. In such cases, your bowel may stop working normally and you may have ongoing constipation. To prevent laxative dependence, consult your doctor if you need to use this medication or other laxative products for more than 7 days. Tell your doctor right away if the enema tip causes rectal bleeding/pain, if you do not have a bowel movement within 30 minutes of using the product, if you have symptoms of dehydration, or if you think you may have a serious medical problem. If you experience mild stomach discomfort, cramps, or gas, let your doctor or pharmacist know. If your doctor has recommended using this product, it's because they believe the benefits outweigh the risk of side effects. However, if you experienced severe abdominal pain, persistent diarrhea, signs of dehydration, unusual mental or mood changes, or severe allergic reactions, seek medical help immediately. It's important to contact your doctor if you notice any other effects not listed here. Remember to discuss any concerns with your healthcare provider. Before using enema, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have dehydration, high/low levels of certain minerals in the blood, kidney disease, stomach/abdominal symptoms, bowel problems, heart disease, liver disease, or if you are on a sodium-restricted diet. If you have had a sudden change in bowel habits lasting more than 2 weeks or need to use a laxative daily for more than 1 week, it's important to consult your doctor before using this product, as these could be symptoms of a serious medical problem. Before surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that young children and older adults may be more sensitive to the side effects of this drug, especially dehydration and kidney problems. If you are pregnant, this medication should only be used when clearly needed, and it is unknown if this drug passes into breast milk, so it's important to consult with your doctor before breastfeeding. When using enema, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's recommended to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with enema include other drugs that may affect the kidneys, such as ACE inhibitors, ARBs, diuretics, and NSAIDs. It's important to note that the watery bowel movements from using sodium phosphate in enema may cause your body to absorb less of your regular medicines and get less benefit from them. It's best to consult your doctor or pharmacist about how to reduce this effect. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it is important to seek medical help immediately. Overdose symptoms may include muscle weakness, rapid/slow/irregular heartbeat, mental/mood changes, such as confusion, and changes in the amount of urine. If you are in the US, you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. It's important to drink plenty of fluids, eat high-fiber foods, and exercise regularly to maintain normal bowel habits. This medication may require lab or medical tests, such as kidney function and blood mineral levels, so it's important to keep all medical and lab appointments and consult your doctor for more details. Enema is a procedure used to introduce fluid into the rectum and colon via the anus. It is commonly used to relieve constipation or to cleanse the colon before a medical procedure. Enemas can also be used to administer medication or nutrients into the body. It is important to follow the instructions provided with the enema kit and to use it only as directed by a healthcare professional. The optimal timing for taking an enema can vary depending on the individual's needs and the reason for using it. It is best to consult with a healthcare provider for personalized guidance. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Do not freeze the enema and keep it away from children and pets. Do not store it in the bathroom. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the enema when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.